The birth of a child is one of the greatest miracles in the world. And every woman deserves to have access to the finest care available to ensure a safe, healthy and joyful childbirth. But for thousands of women from poor and marginalized communities in rural India who receive no prenatal care and deliver in unsafe conditions without a skilled health worker, the journey to motherhood is often a matter of life and death. As a part of the Millennium Development Goals, Oxfam India initiated a project under the Global Poverty Action Fund with support from Department for International Development to improve the status of maternal health in 6 states of India. Aimed at strengthening community capacity to demand access and monitor public health services. At the same time, engaging with the health system at multiple levels to address the long-standing gaps. Large, dense forests surrounded by hills and rivers cover much of the land area in Bilaspur district of Chhattisgarh. The region is home to many tribal and backward communities who have been residing in these forests for long. Deprived of basic necessities and isolated from rest of civilization, their lives are mired by poverty and ignorance. Healthcare facilities are virtually non-existent here because of the difficult terrain.
बहुत सारे गांव ऐसे हैं जो सड़क से कटा हुआ गांव है। बारिश में तो बिल्कुल ही कट जाता है क्योंकि नदी नाले हैं, रोड नहीं है, स्वास्थ्य सुविधा नहीं है गांव में। कहीं कहीं अगर स्वास्थ्य सुविधा है तो लोगों को पता नहीं है उसके बारे में।
जब हमन खुद जब पहली बार गर्भवती बने, ना कुछ जांच होए, ना टीका लगत रही से, ना मतलब कुछ साधन के बारे में पते नहीं रही सके।
Low levels of literacy and a firm belief in popular myths and superstition adversely impact the health of pregnant women and infants in the region.
पहली तो मन गर्भवती रहे 2-3 महीना के तक कोई टोना लगा दी, जादू लगा दी, ऐसे कह के नहीं बताते रही। और जब तक पेट नहीं दिखती तब तक ओला छुपा के रखती कि कोई जादू कर दी।
काम अजजकी होती से तो ओला भूया में सुतावे, जैसे कपड़ा उपड़ा चटाई उटाई बिछा के भूया में सुता देवे और मेरा अंगीठा जला देवे। जब जचकी के समय आवे ना तो जचकी के बाद माँ ला खाना भी नहीं देती रही, यहाँ तक कि बच्चा भी खाना नहीं देती रही, तो वैसे ही मना माँ मन भी खत्म हो जाती।
Maternal deaths are grossly underreported here in Chhattisgarh. Because of this large underreporting, a lot of these deaths are not even accounted for anywhere, and these women do not count. So it's very important that all these maternal deaths count, and that we can then take appropriate action.
Inequality in health has to be challenged, fought, and reduced significantly so that the poorest people can have access to good healthcare as well as nutrition. This was the notion behind Jan Swasthya Sahyog, a voluntary non-profit organization founded by a group of health professionals. JSS has developed an exceptional model of rural healthcare that is accessible and affordable to the poor and marginalized communities in Chhattisgarh and Madhya Pradesh. To address the high maternal and infant mortality in the state, Oxfam India partnered with JSS and initiated a series of outreach programs.
JSS has been involved in trying to provide care for pregnant women As part of that, in the field, we've been able to evolve a much richer and a more appropriate package of antenatal care for pregnant women, so that we protect the mother from dying. We also protect her child from dying and also getting a better weight at birth.
Evolving a community health program with the participation of villagers was the first step towards improving maternal health. Oxfam India and JSS trained a group of tribal women to become the village health workers. These women, who were selected from their villages, imparted health education to women, treated routine and dangerous illnesses, and promoted safe motherhood practices.
अब शुरू से आते हैं 1 महीना 2 महीना हो जही त आते हैं जांच करायला त सबके यहाँ खून के जांच होते 5 या 6 प्रकार के और पेशाब के जांच होते और ब्लड प्रेशर के जांच होते और कखरो ब्लड प्रेशर बढ़े रहते देखर दवा चालू कर देते हैं दीदी मन ओखर आधार से हमन हर 2 दिन में 3 दिन में नापथन बीपी लग कि ओ दवा से ओ बीपी हा कंट्रोल हुआ थे या बढ़े छावे यदि बढ़े छावे मिलते हमन ला तो हमन ओला रिफर कर देथन ताकि अस्पताल में भर्ती हो जा।
अब यदि हमन आएन तो घर घर जाके समझाथन कि जांच करवाए चला तो फिर अस्पताल जचकी कराए चला कि सब जिल समझाथन उखर घर के उखर सास है उखर पति है उखर ससुर है सब जिल समझाथन जचकी कराल की तो अस्पताल लेके तैयारी करते हैं अब अस्पताल में जचकी कराते हैं देखल ले माँ और बच्चा दोनों ठीक रहते और तुरंत खाना मिल जाते तुरंत लइका भी दूध पियाते हैं पल्ले दोनों ठीक रहते।
Improving maternal health requires not only community participation but adequate community control over the processes that generate health. Oxfam India and JSS work towards rejuvenating 30 village health sanitation and nutrition committees in the area, which were earlier non-functional. Today, they conduct monthly meetings on their own, discuss health issues, and monitor the services of Anganwadis and health centers regularly.
ग्राम स्वास्थ्य स्वच्छता समिति ला कोई जानत भी नहीं रही इसे और यदि अभी 3 साल हो गए ग्राम स्वास्थ्य स्वच्छता समिति में पैसा आते लेकिन कोई जानत नहीं रही से ओखर बारे में लेकिन अब यदि का कहते हैं बैठक करत जाथन सब गांव के मन आते पहले तो 10 जन रही हैं लेकिन अभी की स्थिति में बहुत लोग मतलब आते हैं अभी पूरा गांव ला जानकारी हो गए है कि हमारे गांव में ग्राम स्वास्थ्य स्वच्छता समिति के चयन हो है ओमा 10,000 रुपया आते और कामा खर्च होते।
While addressing maternal health, it was important to enhance the capacity of maternants or community health workers whose role involved registering pregnant women in their areas and encouraging them to seek institutionalized care at government facilities. Their relentless efforts have in turn changed the maternal health situation in the villages.
हमारा मितानिन के काम है कि जहाँ गर्भ पता चला थे तहाँ ले ओकर यहाँ परिवार भ्रमण करेल जाथन ओला 4 बार जांच करवा ले जाथन अब 4 बार नहीं अब हर महीना में जांच होते के दिन आंगनबाड़ी में टीकाकरण के दिन भी जांच होते टीका लगवाला भी लेथन गर्भवती मन ला और खाना पीना के भी बारे में आयरन गोली के बारे में मतलब घर में जाथन देखथन ते आयरन गोली खाता धुन नहीं।
More often than not, institutional deliveries prove difficult for the pregnant women due to remote location of their villages. Oxfam India provided training to dais or traditional midwives in the area who were experienced in assisting childbirth. They were educated on the various procedures to ensure safe childbirth and were trained on using low-cost delivery kits.
कई बार बहुत सारी परेशानियां होती हैं जचकी के समय जिसे दाइयाँ नहीं पहचान पाती हैं तो हम उनको जचकी कराने के लिए ट्रेनिंग नहीं दे रहे हैं हम उनको चाहते हैं कि वो लोग जो जचकी कराते हैं उसे हम लोग थोड़ा सा मान सकें और कुछ भी अगर हाई रिस्क फैक्टर है उसको दाई लोग समय पे पहचान सकें।
To tackle the problems and challenges of public health delivery, Oxfam India supported JSS in developing innovative, low-cost diagnostics and promoting rational interventions. The most innovative strategy put in place by them is the malaria detection system.
Pregnant women have a 5 times higher risk of dying due to falciparum malaria, the malaria that happens among the forested people here. So the key to achieving good quality care and outcomes in falciparum malaria is to get a report on the diagnostic technique, that is making a blood smear for malaria among those people who have fever in good time.
The village health workers are trained in taking blood smear samples. These are labelled and neatly packed in small cases which are handed over through school children to bus drivers, from whom the samples reach the Ganyari hospital. Here they are immediately tested and the reports are sent back through the same buses on their return trip. This courier system has been operational in 54 villages in the area and has saved many lives. Another innovative technology developed by JSS to reduce infant death from hypothermia was the sleeping bag. These bags, which contain pouches filled with crude palm oil, can keep the baby warm for hours together, which is a safe, effective and inexpensive heating source.
बच्चा होइस्ता 1 किलो 800-900 ग्राम रही सावाय तो ये बैग ला दिए रिसे वाय नर्स दीदी मन कि ये बैग में सुलाए करिहा तो गर्मी महसूस होही अच्छा रही बच्चा ऐसे टाइप में बोले रही है वाय तो ये बैग में हम सुलाथन.
One of the crucial aspects for protecting maternal and infant health is to ensure access to clean water and sanitation. The villagers were trained to purify their drinking water by adding few drops of chlorine solution. This has been really beneficial to the villagers, especially pregnant women who no longer suffer from waterborne diseases. One of the serious problems that affect the health of mothers and children in the district is malnutrition. To confront this, Oxfam India and JSS introduced Jevnar Melas in the district. These focused on nutrition of women in all stages of life through the locally available food items and its traditional recipes. To enable the community members to share information about maternal health in the villages, JSS has introduced an audio-based software named Mahatari Swara. Through this software, community members can not only provide information regarding births and maternal health issues, but also record their experiences of receiving health services in public health institutions.
हमन महतारी स्वर में वो फोन मिला के लगा देथन उमा फोन करथन कि का सही चीज़ या का गलत तेन ला हमन वही फोन में बता देथन ताकि वो रिकॉर्ड हो जाते तहाँ अस्पताल के मन हमार बार एम्बुलेंस भेजते हैं या खुद आ जाते हैं मन कि ये गांव में ऐसे रिकॉर्ड में आ रहे करके तो हम मन आ जाते हैं और देख लेते हैं.
Reducing maternal mortality is more than just a numbers game. Reducing maternal mortality means mothers are helped not only to live, but to effectively lead healthy and happy lives. Through their innovative initiatives, Oxfam India and JSS have ensured that women have access to quality healthcare services. Yet, much more needs to be done at the ground level to safeguard maternity.